Not yet. Jeremy, you can go ahead and put us on YouTube. Oh, we are live.
I think we're up and running. I know the mayor is going to join us, so when he comes on, I certainly want him to say a few words to get us started, but we'll go ahead and get our March 16th Special Commission on Equity, Inclusion, and Racial Conciliation meeting started. I do know our minutes were deferred, right, for the February 25th, 2021. Certainly don't need to go into the group norms and agreements. So I think we're going to jump into it. It's my understanding, Crystal, you need to go first, correct? All right, so the floor is yours.
All right, good evening, everyone. I know I'm not able to share screen, so what I'll do is just share the information that we have based off of the report that we submitted in January, as well as additional information that we've collected since we submitted the report in January. Of course, our committee members include Melissa Barrett, who's a teacher, Radia Baxter, who works with the Sheriff's Department, Ms. Elise Davis McFarland, who is a part of CAJM, Chris Johnson, who works with the River Dogs, Audrey Lane, who does education consulting and a founder of E3, VG Orr, a student, and myself. Our city staff, we're supported by Eduardo Curry, Mindy Sturm, and Jennifer Gorham. As mentioned in prior meetings, although our city staff serves as support to us, we also include them in all of the conversations and suggestions that we have outlined. As I've mentioned in prior meetings, the way that we decided to go about streamlining our information is to focus on the Kellogg logic model so that we can identify inputs and resources, figure out how these inputs and resources can feed into strategic outcomes and measurements. The 4 areas of focus that we focused on was culturally sustaining curriculums, which of course goes beyond culturally relevant curriculums. And I'll talk a little bit more about that further in our presentation. Family and community engagement, reducing school suspension rates, and anti-racism and equity trainings. So one of the first things that we did was identify different groups and organizations that have done or focus on different areas of work within the 4 foci that we had selected. Within those local inputs and resources include, of course, Charleston County School District, Charleston County Council, the Citadel College of Charleston, Trident Technical College, the Avery Institute, Low Country Youth Services, City of Charleston Recreation Department, Charleston Area Justice Ministry, Father to Father, Charleston Hope, Kids on Point, Wings for Kids, Carolina Youth Development Center, E3, Social Justice, Racial Equity Collaborative. And I would stop reading, but because I've already started, I want to go ahead and include everyone who we have on our list. E3, Social Justice, Racial Equity Collaborative, SC Mentors, Be a Mentor, Big Brothers, Big Sisters, Halos, Low Country Orphan Relief, R3, Laundry Matters, Enough Pie, Green Heart, Charleston County Library, Black Voters Matter, South Carolina Education Association, Low Country Black Parent Association, A. Philip Randolph Institute of Greater Charleston, National Council of Negro Women, Bethune-Leonard Section, local fraternities and sororities, local faith-based organizations, Community Solutions, Transformative Teaching Collective, Mayor's Office for Children, Youth, and Families, Jack and Jill of America in Charleston, National Action Network, YMCA, YWCA, Girl Scouts of America, We Are Family, and 2020 Athletes. And that list pretty much, it's not exclusive, but those are the groups that we identified amongst our collective calls and individual sub-calls. As far as national inputs and resources, we have National Parent Union, American Psychological Association, the Children's Defense Fund, National Parent Teacher Association, the Southern Poverty Law Center, specifically the Learning for Justice, which used to be Teaching for Tolerance, Black Youth Project, National Education Association, and International Institute of Restorative Practices, IIRP, which is the organization that does the restorative practices trainings. So as far as our recommendations, we had a few. I'll just read through those and then also connect them to the areas of focus that they align with. The first one recommendation is for the City of Charleston to take a step back and revisit the process of incorporating the special commission. For phase one, we had educate in doing the groundwork, which included commissioner training in the area of REI. Phase two would be research, which would include interviews, listening sessions, inputs, and funding, etc. Which of course includes other local citizens to get their input as it pertains to youth and education and everything with the special commission that we focus on. Phase three is the analysis phase, which would be to review the data, draw conclusions, and draft proposals. Phase four, execute proposals in phases to include a resolution for a commission on equity, inclusion, and racial conciliation. And then of course, we put in italics, all of these to be done with the support of a consulting firm, which is something that we had already voted on a few meetings back. The next recommendation that we had was to amend the current ordinance regarding the Special Commission on Equity, Inclusion, and Racial Conciliation to 1, extend the time for an action plan. Number 2, require racial equity training of all commission members and city council members. 3, require an equity audit for all divisions within the city of Charleston. And 4, have the Special Commission on Equity, Inclusion, and Racial Conciliation remain a standing commission for the city of Charleston. The next recommendation that we have is conduct an equity audit of all divisions within the city of Charleston, including all youth and education departments. The next recommendation is to provide additional mental health support for students through community programming. A few of the things that we have listed is the Charleston Dorchester Mental Health Center with telemedicine, Charleston Center, MUSC and Roper, I have that in parentheses, with drug and alcohol abuse, the STAR program with MUSC, and then also figuring out a way to support additional mental health counselors within schools. The next recommendation that we had was developing a memorandum of understanding with the Charleston County School District, which includes, of course, 9 areas of focus. 1, support the cultural competency work that they're already engulfed in. Number 2, bridge the gap in family and community engagement. Number 3, officially partner with the Office of Family and Community Engagement, which falls under the Division of Strategy and Communications. Number 4, increase student participation in City of Charleston youth programming, recreation programs, and then also communications and actions as it pertains to human resources. Number 5, incorporate remote locations or pods for youth and families in need. With everything going on with the pandemic, we know that with Charleston County School District, their initial focus with learning pods began, of course, in the North Charleston area, but expanding that to the downtown area in partnership with the Recreation Department would be ideal. Number 6, participate in restorative practice training to be implemented in all City of Charleston programming. Number 7, full implementation of restorative practices in Charleston County schools. Number 8, establish and support community schools throughout Charleston to better provide wraparound services that incorporate equitable practices. And number 9, work collaboratively to develop outcomes measures for assessing the impact. The next recommendation that we had was an MOU with the YWCA of Greater Charleston. That MOU is specific to REI training, which was already mentioned for the actual commission members as well as City of Charleston staff. The next recommendation is develop outcomes measures for assessing the impact of REI training in the workplace and other programs. Under that bullet, we had utilizing the GARE survey results to develop measurement tools for groups and individuals who take part in REI. And then number 2, focus on organizational attitudinal changes that moves towards systemic change. And the reason that we had those 2 bullets is because we often take part in trainings and we also do a lot of webinars. However, collectively, we don't do a really good job of taking what we've learned and measuring the impact on a continuous basis and what needs to be changed or implemented. So that's one of the main reasons why we have that listed as a recommendation. The next recommendation was to implement listening sessions. And this, of course, is something that was recommended under phase 2, our initial, which was our first recommendation, to better understand the youth and educational landscape in Charleston. The proposed idea was to have youth listening sessions, family listening sessions, and then also overall community organization sessions. We were made aware that that Tri-County Cradle to Career is actually already engulfed in doing community listening sessions, and perhaps partnering with them would be a good idea so that it's, you know, we're not working in silos as it pertains to gathering the information that we need. The next recommendation was the incorporation of CDF Freedom Schools throughout the city of Charleston in partnership with other community groups and organizations. This would include increased partnerships with Black and Brown-led organizations, partnerships with CCSD, with faith-based organizations, and of course with CDF Freedom Schools, it already has a family and community engagement component within the entire curriculum, so that would be a plus. The curriculum that they utilize includes culturally relevant curriculum. It has the flexibility to include education around other systems impacting equity and inclusion. And through this program, we could also incorporate anti-racism mini sessions with family and community members. Most of you probably don't know, but I started doing work with Children's Defense Fund back in 2004. And while it was not only life-changing for me, I saw the longevity and the impact it had on the students that I worked with in the community, and not only with their own academics and grades, but overall self-esteem and understanding of self. And of course, when you have an understanding of self, your statistics show that you're more than likely to do better overall. The next recommendation, and I only have one more after this, so you guys are lucky, an MOU with Tri-County Cradle to Career to collect data and track progress towards racial equity, provide training to parents and community members about the achievement gap, assist in facilitating listening sessions and data collection to inform best practices and needs of our constituents, provide support to the City of Charleston Commission on Equity, Inclusion, and Racial Conciliation, provide support to the City of Charleston Equity, Inclusion, and Racial Conciliation Manager, Amber, I could have just said Amber, in the implementation of recommendations related to youth and education. And then the last recommendation that we had is, of course, to ensure that all City of Charleston offices and departments implement an equity plan within their policies, procedures, and framework. Now, I know I've said a mouthful, so I will add this document, which most of you already have, in the chat as well, just in case you're a visual learner and not auditory. And that's all I have. Any questions?
Thank you, Crystal. I'm sure we've got
That's all?
No, that I promise. Well, that's for today. Hold on one second. I think I missed 2 pages. No, I'm just joking. I see Mr. Dudley had a question.
Yeah, great report. However, my question is, have you come up with any recommendations that would dismantle a structure that has systemically discriminated against our children for tons of years? I mean, and when I mean structural changes to our educational system.
Right, I feel you. And one of the things that I had to learn and remember, like with this work, because I want things to change like 2 years ago, 3 years ago, 38 years ago. But that's one of the reasons why we had the initial recommendation. The way we stepped into our subgroup as it pertains to youth and education, we're all coming from different aspects of working with youth and education. So when it comes to that, it can be very specific or very broad. And the only way to figure out exactly what we want to pinpoint as a city is to take a step back, do the research, actually talk to the individuals who it's not only who's making the decisions, but also the individuals who it's impacting, so that we can figure out what the best recommendations are. So all of the recommendations that we have listed would feed into that. However, I don't feel comfortable just, implementing programming that, of course, research shows works in this specific location without actually doing the correct groundwork to make sure that it's going to be implemented effectively and correctly.
And I guess I'm being a little more basic. I mean, just empirical data alone we could see that there are inequities in our schools.
Right.
And
I'll tell you,
I'm talking basic things like the physical plant has an unbelievable effect on learning, creating the kind of environment that is conducive. I'm talking to the choir. I know, Crystal. I'm sorry.
No. I don't look at it. You're good.
I'm hoping that we could get to, the vestiges, of slavery and Jim Crow that continues to have an effect on our school system and the inferiority of that system with regards to Black and brown kids.
Well, I'll tell you this, and this has been an ongoing conversation with not only our subcommittee, but with other individuals within the commission. One of the things that that I was very surprised by returning to Charleston in 2016 is learning that you all had CDF Freedom Schools for a couple of years and no longer had them. Or I don't know what the situation, I know there was a conversation about there not being additional funding or whatever, but knowing the impact that program has on racial equity, empowerment, family engagement, suspension rates, and overall education progress for Black and brown children. To me, it's a no-brainer because I know how it works, not only in local areas, but nationally. So that's why we had that listed as one of our recommendations. And the other thing that I do want to share is, and just listening to what you were saying, Councilman Gregory, I think back to Septima Clark when she had her citizenship schools on the islands. And one of the reasons that was so impactful and caught traction and ended up spreading across other areas of the South is because she spoke to the people to figure out what it is that they needed and figure out what it is that they knew in order to best help and support them. Right now, because we're all, either professionals or have worked in the educational realm, I don't feel comfortable making recommendations for someone who lives in a different area or has different experiences than me if I don't know exactly what the concrete and deep down issue and concern is. And until we get past the surface level, we will not have any progress. One of the other things that I wanted to also stress is making sure that with this special commission work, it's not just a special commission to put together recommendations, but also a commission that is a space where these initiatives or recommendations are held accountable. Because a lot of times we'll say things and incorporate things and suggest things that sound good and look good for the moment, but don't want to do the long haul work that it takes to make sure it's successful.
If I could add to Councilman Gregory or Dudley's points, and so I think for me as a district employee, one of the questions I ask Crystal all the time, and I think we need to differentiate between programs and systems. My issue every day is I question the system that we're working in, and it seems like a lot of the recommendations currently are focused on working within the box or the system that's been given to us. I personally would like to see some recommendations push the status quo a little bit more in terms of not working within the system. So let's think about alternatives to offering high quality education downtown to parents downtown. I think the data is out there, to Dudley's point, that it has been a year after year achievement gap that's been getting worse, opportunity gap that's been getting worse. So I think the data is out there. All I'm asking as a co-chair is I would like to see some recommendations that quite frankly get some of the Charleston County School Board members' attention.
So I have a good point. I guess my question to you is, of the recommendations that I shared, I'm trying to figure out which ones already fall within the system that's already in place. Because I mean, when you mentioned that, I was puzzled because in mentioning community schools, that is not something that is implemented. Because I work with Charleston County School District as well. As far as freedom schools, that curriculum is totally out of the box. It's totally different from what they have now. When visiting in different classrooms and speaking to different administrators and teachers who are trying to meet certain benchmarks, the entire curriculum itself, do I feel needs to be uprooted and redone? Yes. However, our commission group had to switch our focus from that because this is not a special commission under Charleston County School District. It's a special commission under the city. So as it pertains to the city and working in collaboration with CCSD, yes, the MOU can go beyond that spectrum, but at the same time, we have to make sure that we have people not only on the board, but who are making decisions for Charleston County School District who are ready to think outside of the box. And does that mean that some changes need to be made at the leadership level? Oh yeah, I do wholeheartedly believe so. But at the same time, what happens is we know that, but we have parents and families who are intimidated by the current system as it stands. So that's why that is so heavily within our recommendations, hearing from the people who are impacted the most, because that's not happening. Mm-hmm. We always hear that they get, there's feedback from surveys, there's feedback from this, but it's not the least of them that we're getting the feedback from.
Hey, Crystal,
Crystal, I wanted to jump. I'm sorry.
Oh, that's all right. Kimberly, go ahead. You had your hand up. And then
yes. So I just want to say thank you for putting in space to actually learn. I think so often we're making decisions and we're not looking at the data. We're not figuring out the stats. And it's so often that when you hear those startling stats and facts, it empowers you to do something different. So thank you for outlining that. I agree with Councilman Dudley that although when we go back to do our final drafts, I would like to see those concrete steps of what an ideal school district or ideal city and school relationship would look like, because I don't want us to just stop on the education, right? Where we're just having conversations, or we get into analysis paralysis, where we're just looking at the data, but no one's moving. But I do appreciate that you guys thought about presenting those stats and facts to the people, because we don't hear them. We live them, but we do not hear them. And we often need to know and be validated to know that those experiences are real and they show up in numbers. And then the second thing, I may have missed it, but I did some work with Richland County School District 2, and they have started talking about how they can incorporate EDI training from K through 12. So what could that look like in Charleston? What does it look like to start teaching our kindergartners about the same types of constructs that we're trying now to teach adults? We know that children are sponges, right? And so if we start in kindergarten, then hopefully by the time they become 30-year-old adults that are leading our city, we're on 2.0, hopefully 4.0, but 2.0 at least. But starting young, hopefully we'll start to change not only our schools, but our communities and our families and our lives for the greater good.
Definitely. Thank you, Kim. Mr. Harris?
I think Jerry had a question first.
All right, thank you. Crystal, thank you for your work in the committee's report. As a number of you know, in 2019, I was involved with 2018 and 2019, I was involved with the Charleston Freedom School, the mayor's office being supportive of that effort. We were certified as part of the National Children Defense Fund program. And you guys may remember John Hale was actually began the activity in 2017. We got through 2018 and 19 and ran into funding challenges as well as school facility challenges. And everything that Crystal indicated about the efficacy of the program at multiple levels is true. It being infused as part of the DNA of the Charleston school system could be transformative and in a way that addressed the question that Councilwoman Gregory raised. In addition, a systemic issue that is not addressed in the report. And I'd like to give you guys a little bit more work, Crystal. You tangentially addressed in the restorative justice aspect the notion of the school to prison pipeline. But specifically, I'd like you to take a look at the police department's general order 40, which has to do with juveniles, that specifically speaks to the relationship of the police, how they deployed, and the reporting related to youth and the school system. And that's an area where our two subcommittees can work and share some information. I think, Councilman, that could be some low-hanging fruit in the area of systemic attacking systemic basis of racism in the system.
Thank you. I made notes, so I'll be reaching out to you after the call.
Can I just I love this conversation, by the way. I think it's really necessary as a commission to have this kind of dialogue, and not just on education, but all of the committees. This one's really, really good. In terms of data, okay, I think the data is already there. We are basing a lot of what we're doing on the Avery study, which was very, very specific in terms of where the problems are and making specific recommendations to address the problem. As for the distinction between the school board and the city, as a council member, those borders don't count, because the children and the parents associated with those schools are my constituents. So as a result of that, okay, I think that gives me the responsibility as a councilman, regardless of the institution, to be forthright with constructive criticism and to hopefully do something different, something out of the box. And yes, there are best practices out there as well. But I just want us to do something that is really out of the box in addressing the issues that we're missioned with.
I have a quick question, and those with doctoral degrees can probably answer better than I could. When it comes to, I know, matter of fact, our first, second, and third meetings focused a lot on the Avery study because we reviewed all of that data. And that data was covering, was that 2010 to 2015?
Yes.
Okay. I'm wondering, because it's 2021 and we have a lot of families who are coming out of or still dealing with the recent pandemic, if it would make sense to collect additional data, because things have shifted and changed, especially when it comes to learning loss after the children being out so long last year. So collecting additional data, I know using the Avery Institute as a base was our foundation for the recommendations that we implemented, but collecting additional data, I don't think it ever hurt nobody. And
No,
especially
I don't
after the
think so
pandemic, I think
either,
it'd be a
but
good idea.
Again, we already know, based upon data, what the virus has done in terms of learning deficits. We know it. So what I'm saying is, then let's try to do something right now based on what we know that can assist in addressing what we know is going to be an unbelievable learning deficit on Black and brown children. I don't need any more data to tell me that. What I need are recommendations on how we can address it. And I don't mean the city by itself. I'm also talking about the school board. And that's the kind of out of the box I think we need to be about at this point, making people uncomfortable. If we don't if we don't do that, I don't think we're quite doing what we're charged to do.
Agreed.
Thank you, Dudley. Tracy, and then we're going to transition to health disparities in a few more minutes. But Tracy, go ahead.
Yeah, I just wanted to comment as Crystal, great report, and as you were talking, and Dudley, as you were talking, how much the overlap here is, and that a child in school who lives in poverty, and a child who is hungry at home, and a child who doesn't have internet access. I don't know how to, I mean, I know the physical conditions of the schools, and, you know, if they have to walk through dirty floodwater to get to school, how is their morning going to be? It all overlaps, and all the different issues we see in the city around all of those issues. And, you know, I think that we talk about these things, but there are different boards and oversight groups that control it. And unless we're calling into those board meetings, we're addressing some of those issues, they don't really have to face it. So I don't have a specific answer. I just really feel that it is so overlapping, and that it does involve doing some things that make people uncomfortable and may make us a little uncomfortable. But that's all.
Thank you, Tracy. Any other additional questions on Crystal's report? And then Mayor, we'll, after the next report, we can just kind of touch upon the discussion we had today, just about next steps. So we're all on the same page. I know we all have questions about next steps and the final reports and all that. So we'll get to that after the next report. Is that okay with you, Mayor? Okay. I'm not sure, Amber, who's leading off.
It's me.
All
right. Well, Crystal did such a good job condensing her report. I will try to do the same. So hello, guys, again, Kim Butler-Willis, and representing the Health Disparities and Environmental Justice Subcommittee. The purpose of our committee, just to remind you guys, is to explore issues related to health and environmental equity, determine which issues are most salient in the city of Charleston, and to identify those key priorities that would produce the greatest impact. And lastly, to present these priorities to you guys for evaluation, edits, and facilitation. We have 4 priorities, and they touch on 4 major groups: social determinants of health, healthcare access, COVID testing and vaccination, and then lastly, flooding. I will say that we have a heavy health group. We do have some environmental justice warriors on our subcommittee, but please know that we do have a heavy health group. So please, I encourage you to lean into the environmental knowledge that you have, and please share that with us. All right. So first up is our social determinants of health. And what we want to do is improve the life expectancy of minorities and or underserved communities by implementing some policies and programs that consider not just health, but the social determinants of health, giving everyone the opportunity to reach and enjoy optimal health. I'm sorry, I thought I heard someone. Okay. So our rationale behind this is that this priority, the social determinants of health, allows us to not only place emphasis on the individual, but the entire population and the community level. Because we know that when we can improve the lifestyles of the least of us, quote unquote, then we know that we will improve lifestyle and quality of life for all of us. So these are some things that we're recommending based on the 2019 to 2023 Tri-County Health Improvement Plan that was developed by Healthy Tri-County, which is a collaborative that the city has been heavily involved in. First things first is to mandate a health and equity, not health inequity, but health and equity in all policies approach, not just for the city departments, because I know that's something that you guys are already tackling, but all city sponsored programs. So if you receive a grant from the city of Charleston, we should start to encourage others to make sure of those grantees that they are considering health and equity in all of their policies and demonstrating that on their grant applications. We also want to encourage healthy eating and physical activity by incorporating some obesity prevention tactics like sidewalks, green spaces, even senior activity areas and low price farmers markets in the city expansion and event planning efforts. We know that people make choices based on the choices that they have. And so we want to provide some healthier options for the people within the city. We also want to identify and promote SMART, and SMART meaning specific, measurable, attainable, realistic, and time-oriented city-endorsed health disparity initiatives to encourage collaboration and collective resources among strategic partners. And that's not just our hospital systems, our healthcare providers, but it's also our health insurance agencies and our schools and the state agencies and the other CBOs, our community-based organizations. I will tell you, as a leader at Roper St. Francis, we have a phenomenal culture of collaboration here in the Tri-County, and one that we will continuously need support from senior leadership to foster, because in the healthcare space alone, we have people that are routinely working together, but we need that continued juice and fire to make sure that we can continue to make the plans that we have work. We also want to explore the synergy with DHEC and the Department of Health and Human Services, the managed care withholds and incentives. So these health insurance agencies, they've started to incorporate or consider full wellness for patients, and they have programming that patients can use, case managers, and other initiatives that really encourage full wellness and healthy eating. How are we promoting that or even encouraging that from the healthcare neighbors in the city and even the residents? And then lastly, under that initiative, we want to also implement the Office of Minority Health's 15 national standards of culturally and linguistically appropriate services. Our CLASS is what you may often hear within the City of Charleston departments, and promote its use as a roadmap for improving equity among organizations that are serving citizens in the physical, mental, and socioeconomic health ecosystem in which we live, but not just, again, limited to the traditional partners of the healthcare facilities and health insurers and schools. We want to think broader than that of our non-traditional partners, mostly those business partners, and even those that we know tend to hire the underserved community. I made up an acronym this week. It's called RUPOC. So it's our rural, uninsured, and people of color. And those are truly priorities when we start to consider healthcare disparities. So again, those rural communities, the uninsured community, and those communities of color, our people of color. The second priority we have is our healthcare access, and that's to increase the number of high quality subsidized healthcare providers on the Charleston Peninsula. Unfortunately, we know that Fetter right now is the only healthcare game on the peninsula. We know we don't even have a DHEC clinic on the peninsula right now, and that's a shame. So essentially, uninsured folks or folks that are don't have access to healthcare outside of peninsula are stuck with Fetter. And I shouldn't say stuck, because Fetter has been doing a phenomenal job providing care, and they have been blowing it out the water with COVID vaccine outreach. But we want to provide our uninsured folks and our folks that struggle with access the same opportunities that we would those with insurance. And that means options, and we have none on the peninsula. The 2016 and 2019 CHNA, the Community Health Needs Assessment that was conducted by Healthy Tri-County, show that nearly a quarter of the people in Charleston County cited work schedules or lack of health coverage or even lack of income as barriers that are preventing them from routine doctor appointments. And so we want to make sure that they have options, non-traditional hours, in order to make sure that they are taking care of that very critical need. So 4 action items that we're suggesting is to recruit more subsidized healthcare providers in our services in the city, to include DHEC, bring them back. The people look to DHEC as a healthcare source. It's a traditional healthcare source, and we need to have them back on the peninsula. B, we also want to offer public transportation waivers for medical and social support appointments. We always, we're chronic for labeling patients as non-compliant in the healthcare world, but have we considered all the barriers that they're confronting in order to make those essential healthcare appointments? Thirdly, we want to encourage some non-traditional hours for healthcare providers and services within the city. And then lastly, advocate for education training and the use of Z codes at local hospitals in order to capture the data. So much like Crystal talked about with gathering data, the data drives performance, the data drives policy. And if we don't know the data, if we don't have the data, it's very hard for us to argue our case because everything after that is subjective. So making sure that hospital systems, especially Roper, MUSC, Trident, and East Cooper, we're using those Z codes and compiling them to see where the needs truly are for the populations that we serve. And I can answer any questions you have about Z codes after I'm done presenting all of the priorities. The third of the fourth priority is COVID testing and vaccination. Right on the nose, we are in the thick of it right now. And I want to shout out Feder again, because they have been doing a phenomenal job getting to those rural and underserved pockets, but we know that there's still a great need. In fact, Crystal and I were talking ahead of the call. We're hosting a Monk's Corner clinic because we knew that 75% of the population that's 65 and older in in Berkeley County still weren't vaccinated despite all of these efforts. So there's still a lot of coordination and collaboration that needs to happen to make sure we're getting to the right people. So first things first, we want to increase that COVID prevention, testing, and vaccination education. Education leads to empowerment. And when people feel empowered, they're more engaged in their health care. We talk so much about vaccine hesitancy among African Americans, but have we stopped to consider vaccine hesitancy among our white folks? White folks are dying too from COVID, and we know that conservative white folks are denying the vaccine. We will not reach herd immunity if we are not considering all populations, not just hyper-focusing on Black and brown folks when it comes to this vaccine. So we have to expand our reach in our education efforts. Secondly, we want to host and post simultaneous testing and vaccination locations with varying hours and testing options. We know that a rapid test works for some may need that standard test, but there is not a central location, unfortunately, here in the Low Country, where you can go to one site and learn where all the testing and vaccination sites are, so that not only the resident can determine where they need to go and what best suits their life, but even healthcare providers. How do we best coordinate so that we're not being duplicative or oversaturating a community? And then third, we want to offer free or at least subsidized disinfectant cleaning products, toiletries, face masks for families and individuals in need. I know that's a big ask because Lysol is like a hot commodity right now. But if you need those types of cleaning supplies, how do you get it if you aren't able to actually purchase it on your own, given the spike in prices? So how do we work with our local vendors to make sure that that's still attainable for those who need it most? And then the last priority we had is flooding, and that's to invest in strategies that mitigate flooding, prioritizing strategies that address racial equity and environmental justice. Please don't go hard on me on this because my environmental folks are not on the line right now, but I will tell you, they are passionate about it and there are some valid concerns. So of the 4 recommendations, we want to provide elevation grants in low-income neighborhoods. We want to create open spaces that can function as water storage spaces. We want to continue to invest in drainage projects outlined by the city, providing routine updates to the public. I think that's essential. Again, getting back to the education leads to empowerment. And then lastly, we want to increase marketing and promotion of existing environmental initiatives like your Adopt the Drain and Charleston Rainproof program that's already existing. And then last but certainly not least is climate change. So acknowledge and proclaim climate change as a public health crisis. We want to first review and revise the Charleston Climate Action Plan, ensuring that recommendations are provided with consideration of race and socioeconomic status. We want to negotiate a population control measures with the city's major commercial polluters like Carnival Cruises. We know that they're a major industry for us, but do they consider the amount of pollution that they're now putting into our environments? And then lastly, we want to enact a proclamation and complementary policies that reflect climate change as a public health emergency. And those are the recommendations of our subcommittee. Any thoughts, feedback, or recommendations for edits?
Wowzer. That's a lot.
It's a lot, right? We're an ambitious group.
You are. I have a couple
I'll
questions.
say again, that's all?
That's all. That's all, Mayor. Pull up those bootstraps. All right.
Kim, is that all right to call you Kim?
Absolutely.
Who else is on your subcommittee? You said you had some some of our environmentalists.
Yeah. And I wish I had the full name. I actually put it in the chat because I don't want to miss anyone. So I will put all the names in the chat, but we do have a few city folks, city officials, our city workers that are helping us to build this plan. Outside of Paul Wieters, who's our City of Charleston health guru, we also have, pull up this.
While you do that, and it rings a bell for me, I just want to acknowledge to the mayor and Amber about the support that some of the subcommittees have from city staff. Dudley and I were talking about this earlier. We have seen a maturation in a lot of the staff members embrace the work that we're doing, talk about it at council meetings. So I just want to say kudos to everybody for really drilling that down and then having them really take it in and start talking about it at council meetings. It's been really encouraging for us.
So also from the city, we have Katie McCain, who's been helping us on the environmental front. Marcus McDonald, who's a strong advocate in the community. I believe he's from downtown, who's very passionate about environmental justice. And also from the city on our committee, we have Mike Wack. And this committee also consists of Ariana Keels, who's a member of, who's a teammate of PAR. And of course, I said Paul Wieters, and then Samaj Fielding, who's also a community member, and Dr. Rivers from MUSC.
Well, thank you. Thank you.
And Renee Lanyard from Trident United Way.
Isn't his name Chris, Kim?
Oh, Chris Welch, who is a former employee for an insurance company. I want to say Molina, but it's not Molina. Select Health, I want to say. Yeah.
Any questions?
Mr. Harris has his hand up, and then I saw Tracy.
So Kimberly, fantastic work on the part of your committee, thought-provoking, and I think some systemic related stuff. Two things I'd raise. One, in the area of mental health, there's a discussion going on between our work group and Marcus, at least, to come up with some ideas and recommendations specifically about how the city's first responders to situations are not necessarily the police, but others, and how we do that. That's a specific area that overlaps with the work that we're doing. And I'm wondering whether or not there's been any discussion about utilizing crime prevention through environmental design as an approach to making the city safer straight away through all communities. For example, the rehabilitation that's being done in the public housing projects, whether or not the design that is being used is anticipating how the height of the hedges, the setback, and those kinds of things are important in terms of reducing the possibility and opportunity for crime. So I'm just wondering whether or not that's part of the discussion that you guys have been having.
It was not, but I love that you raised that, because that proves a great point of the intersectionality that's possible between these subcommittees. But I just made a note of it to take it back to our group to see what's our part in that development, and hopefully that we can build some bridges with the other subcommittee who's looking at just that. Yeah,
and Tracy, in terms of the discussion about mobility, the low line design aspect, again, there's an opportunity for us to incorporate that to be helpful to make the police jobs easier, and perhaps have the perception of lowering the perception of over policing.
Mm-hmm. It's mutually beneficial, right?
Mm-hmm.
Yeah. I'm sorry, Ms. Doran, you had your hand up
Yes,
next.
I stepped away for just a minute, and you may have addressed it in the beginning, but I was wondering, did you include telemedicine in your You did, okay.
I did not. No, I'm nodding
did
to say
not.
that was
Okay.
certainly a conversation for us, but we weren't sure where to place it. With the healthcare access, we were hoping that with expanding those hours and creating non-traditional options, that telehealth would be included. I think COVID has forever changed how healthcare looks, and we're hoping that some of the changes actually become sustainable. But we should explicitly say telehealth to make sure that that's encouraged.
Yeah, I mean, we have Humanities Foundation has partnered with Medical University, and we have in all of our senior properties, and a good majority of our residents are of color, so and low income, and the nursing schools in different markets participate, and they use it as a learning model. And so they come through as part of their education. And it's been a really good program for us. Medical University has fallen off a little bit here locally recently, and during COVID, they aren't having classes in person and stuff. So, but it really worked and engaged our residents and brought their healthcare to them. So
thank you for that. Thank you for that. And Crystal just mentioned that that's something that they can include it. So again, another intersection that we could probably leverage in order to see some real change. So Crystal, I'm making that point too. And thank you, Ms. Doran, for that.
So, Mr. Chairman, just a comment, if I may, and sorry I'm not in my office where I pull this. I keep this little map near my desk at the office because it seems so powerful to me, Kim, and I know you're familiar with it. I've kind of egged DHEC on to drill down and make it a little more accurate per smaller areas, and I mean, we're all about addressing disparities here, and that's why we separated in these different groups, because these disparities are pervasive, right? But the one that hit me like a ton of bricks was about a year ago. I first saw this map that shows life expectancy in different parts of our city. And I know there's the old expression, you know, different sides of the track, and this side, different sides of the river. On the Charleston Peninsula side, the Upper Peninsula and lower part of North Charleston, the life expectancy of citizens there is about 66 years. I'm be 66 this year. I hope I live a little longer, you know. And if you go just across the river to West Ashley, to those neighborhoods, of course, over on the Charleston side, they're mostly low income, mostly African American. And you cross the river and they're mostly white, mostly moderate or higher income. And the life expectancy is 81 years. So just literally less than a mile away across the Ashley River, a difference of 15 years in life expectancy. I mean, that's getting real, y'all. I mean, 15 years of someone's life differential. It just seems so powerful to me. And you mentioned up front life expectancy, but and maybe it's just a picture that says 1,000 words, but I find that to be very powerful and a motivating story to help get us all addressing this health and wellness and equity in our community.
Mayor, thank you so much for bringing out that stat. And now we know that COVID has even exacerbated that and added an additional 3-year deficit for people of color, right? Nationally. Wow. So we are really struggling. And so when we look at mandates like the phase 1A, who say we're going to vaccinate people that are 75 and older, well, that doesn't consider Black folks, because we're not even living to 75. So, but yet still, we are the people that are dying disproportionately of COVID. So that's what we're talking about when we say health and equity in all policies, because had those that rolled that down considered the life expectancy of Black and brown folks, I'm sure that age would have been lower, and we wouldn't have been prioritizing only those long-term care facilities where we know those are 70% white, or those healthcare workers are the 75 and older. We would have had an augmented schedule that considered equity for all people. And it certainly should have been 55 and older, I believe, for Black and brown folks since the beginning of the phases.
Hey, Kim, this
good point.
Mm-hmm.
A question for you.
Yes, sir.
any focus on the homeless population? I know you talked about the uninsured and making sure that DHEC is reestablished here and there's access. But do you have any particular focus on that population alone?
We did not explicitly lay out a plan for the homeless folks, lumping them again under the uninsured folks. We know that 180 Place has really been a major driver for our aid and assistance with homeless folks, but maybe it's worth adding a parentheses to really call out these high need, high priority groups, because we know on the peninsula that homelessness is a chronic and very serious issue. Even when I keep going back to COVID, y'all. I'm sorry, because I'm in COVID world. But even when we consider vaccinated our homeless folks, it's 2 doses. Before Johnson & Johnson, it was 2 doses. You know how hard it is to find a homeless person the second time around, especially if they haven't deemed a place to be their permanent home. You know what I mean? So again, considering equity in all spaces and all rollouts, Johnson & Johnson is key for homeless folks because it's that one shot and you're done. And even for our transient folks who aren't homeless, but maybe couch surfing. But yes, we can explicitly call out those priority groups.
Thank you, Dudley. And Kim, is there anything else for Kim before we transition?
Could there be more people? Could there be more?
All right.
All right.
I think that's all we have. But I certainly wanted to close out with the mayor to just talk briefly about our schedule, what to do on our plates over the next month or so, and then also reaffirm the commitment about the work that we have ahead of us. So I'm going to let Mayor just kind of take it over from here.
Well, thank you, council member. And I met with council member Saccharin and Gregory today to kind of discuss our path forward a bit. First, I want to thank everybody on the commission here for the awesome work you've been doing. I admit I didn't attend a whole lot of the early meetings, but I've attended the last 3 while the presentations have been made, and I've been impressed and uplifted and inspired for us all to continue this work together. Now, it's interesting that Crystal had a number of recommendations on her list tonight about the future of this commission and what that should look like. And I do want to remind everybody that the original charge from City Council for our commission was simply to gather and make recommendations back to council. Of course, one of those recommendations can be, what are we going to do as a commission going forward? Will it continue to exist and all like that? So that's very apropos, Crystal, that you included those tonight as part of your report. Both reports tonight were terrific. So I think it's time for us to think about the transformation of this commission from one that just is done solid work, research, and more of all that needs to be done in many sub areas, many topics, I'm sure, and that can be part of the work going forward. But to transform us from making recommendations, go ahead and get that done, make those recommendations, but transform us to a group that's action oriented and intentional about steps that need to be taken and accountability that should be added to our community to see that real change occurs over time. And so I would like to, I know there's been a good bit of discussion about how formal the reports need to be and format, and whether we ought to hire somebody in to make it look nice and complete and all like that. With y'all's, with all due respect, I'm ready for us to bring this on forward to council in terms of our recommendations. One, though, important recommendation was on Crystal's list tonight, as I mentioned, and that's to empower this commission to continue to exist and to move forward, transforming its role to be one of more implementation and action and accountability. So, and I know it would be nice. I talked to Amber about, writing up, a good summary of our work, how many meetings we had, what our purpose was, and all like that. But go ahead and get our reports on in. And I know we've moved the goalposts a few times, but I really would like for us to get that done by the end of April, by April 30th. We have 2 council meetings in April. It'd be nice perhaps to do it on April 20th. But the other thing that I would consider after consulting with my council members is maybe we have a separate workshop meeting. Sometimes we do that when we focus on one issue. Sometimes when we have city council meetings, and there's 20 different things to talk about. So it might be better for us to schedule a special meeting of council to make this presentation, to talk about the recommendations going forward. I would have each of you come forward and be a part of that meeting to share with the entire council. And that will set the stage, I believe, for us to transform our work and to continue our work kind of on a new pathway that will get some things done. And the other thing that I get anxious about getting going, when I hear good ideas, and we're not pausing, by the way, if we see an opportunity. Like we talked to council just the other day about a minority business incubator. We have an opportunity coming up with the construction of a new building on Lee Street. We've talked to the developer that we're partnering with the city, and we can take the ground floor of that building, about 8,000 square feet, and go ahead, and we're moving forward to make plans to have a minority business incubator. That was one of the recommendations of this commission. So, I'm ready to start trying to make those things happen as they become available, and as we're intentional about doing these things. So anyway, I probably talked long enough, but that's where I would like to see us move, to wrap up the recommendations and then move forward with a continuance of our fine work. And admittedly, that could involve, looking at the number of members on our commission, maybe changing the structure a little bit, setting term limits. I mean, we got together with just that one purpose, to make the recommendations, and until council acts, that we're out of work, so to speak, once the recommendations are made. So we'll need to put a little thought into what the structure of this would be going forward. But that's my hope and intent, and I think it is of our co-chairs as well. And I hope that resonates with all of you as well. Thanks.
Thank you, Mayor.
Questions, thoughts, ideas? All pretty quiet.
Anything?
So, since everybody else is deferring to the power of the mayor and his thought, clearly the work that's been done so far is extraordinary.
Yes, sir.
I think the concern I have, Mayor, is that if we put forward recommendations for action by the council, but we don't have a clear understanding of how we want the commission to be structured going forward, how we haven't had the opportunity for the cross-fertilization between the various work groups, which I think, whether we talk about the social determinants of health or other things, there's some integration that's missing. And quite frankly, I thought the idea of having a expert who has done or watched these kind of processes go forward in terms of best practices, taking a look at where we are and making some recommendations about how to make the recommendations and what we should look like going forward would be beneficial to us. and rather than us, flying blind, so to speak. And with all due respect to you and the two co-chairs, this work is not stuff that you guys do as your day job. And there are people there's a whole industry evolving around DEI. And there's a great opportunity for us to do this and do this right. And I'm just not certain that putting forward the recommendations without having kind of a game plan that kind of harmonizes stuff. And I'm not talking about, I never thought we were talking about having somebody write a pretty report. It was a question of how we processed and integrated the information and move forward. So I'm a little bit uncomfortable with going forward. We could have a report with great recommendations. The council could be taking action, but we really not have a framework to sell to the broader community in terms of how they can become involved and how we move forward. So I'm just a little bit uncomfortable with the timetable.
All right. Well, we started with a 90-day timetable, and we started last summer. So I think there's been ample opportunity to make those recommendations if you have some to add to what we got here. I hear you, Jerome. I'd certainly hear you loud and clear, but at some point we got to move on. And how long, I'm ready to get some things going. I guess maybe I'm impatient sometimes, but sometimes that's a good thing. Sometimes it's not. It can swing both ways. I mean, if there's someone that can give us some advice on how the commission should be structured by the time we present to council, I'm all for it. Bring it on. What does that look like?
Yeah, I appreciate what you just said. I would love some strategy behind it. I think we presented some great ideas, but and even in our conversation tonight, we've seen some intersectionality, right? So it would be nice, even if we don't hire the consultant, to at least get together as subcommittee leaders in a 90-minute meeting to kind of think through what this looks like, maybe facilitated by Amber, to bring all of our recommendations, see where we parallel, see where we where we're intersecting, so that we can synthesize and present one solid document to the council, so that we know that when it's time to operationalize, or if we do have the opportunity to hire a professional who's keen in this, they have something solid to work with. But it would be nice to bring those plans together in a off YouTube to hammer out what a solid plan looks like to present to the council. Because right now it does feel a little fragmented, if that's what we're going to work with.
I agree. And in follow up to what Kim was saying, I was actually texting or typing the exact same thing she said. Perhaps Amber works with the committee chairs to actually build out or figure out what that framework should look like. I think that would probably be the best thing to do.
And Jerome, let me just reply that can be a recommendation. I mean, we can't spend money until council approves it. We did set up a budget for this year that we have some flexibility with, I guess, and we were thinking about using those funds. But to start doing things and spending money, we need council's approval on those kinds of things. And so, maybe one of the top recommendations is the format of the commission, hiring someone to help the commission do this, what you just said. But, it would help us to go ahead and get them on board and get them advised where we're going with all this and the kinds of recommendations we're making. So again, maybe I'm being a little impatient, but I want to do this thoughtfully. I hear you, but let's figure this out so we can go ahead and get on to the next step.
I think Tracy had a question. Tracy?
I know we're short on time, so I'll be brief, but I think that it would be helpful as well to go through our recommendations and make sure that the commission as a whole is pleased with what we're taking forward. Like, I know we had 7 or 8 things that the commission may not agree with everything that we're taking forward. So I think working with Amber to sort of look at some of those, and then some of the items that we had on our recommendations have already been addressed by, like, the fee in lieu and the low line and some of those things. Do we keep those on there or do we take those off? And I'm a little, I don't know if some of those items had already been, in process with the city for a period of time, but we didn't really know that. So were we duplicating efforts? So I think I need to work closer with Amber on that to make sure we're not doing things that are already taking place within the city.
I'd leave them on there if it were
Okay.
me, just because that's a good thing to have a box that, gee, we're already working on this, or
Yeah.
some of it you've inspired us to action already, as I mentioned.
So Mayor, in the context of the April 30th kind of, is that for us to have completed our exchange and conversation amongst us to have a document that would be presented in May, or is it between now and April 30th for us to have these conversations, complete the writing, and get the report out? I'm just trying to understand your timing.
Yeah. Well, originally I was going to say a drop dead by the first meeting of council in May, which would be May 11th. That's 2 months. Come on. That's almost 2 months. We can do the things that y'all are mentioning in the next 2 months and have this ready by May 11th. How about that? If I got a deal?
I'll defer to my colleagues. We've got volunteers, who are working to generate the work so far. If I had a staff that was working full time, I said that's cool. We could do that, right? I'm just not sure. We could set that as it's a reasonable time frame. Understanding we need to show productivity. I just don't know whether from a practical can get it done, pencil to paper, and presentation, even with Amber's support and however much support from the city staff, we can get that. That's all. And I defer to my other colleagues in terms of their comfort level.
I think we have the work on paper already. It just doesn't look right. So now we work on getting it to all look the same. And I think we can do that.
I believe
Okay.
Kenya had a question, had her hand up. Go ahead.
Yeah, thank you so much. Good evening, everybody. I'm sitting in for Alvin from the Economic Empowerment Committee and Subcommittee. So my question is the intent to produce a roadmap of sort, Mr. Mayor, when we go to City Council? Because 2 words that come to mind as I'm just taking in the dialogue that just took place is strategy and prioritization. And so if there is that what we're trying to accomplish is to really get a strategy around what are the priorities like, because this work is going to span years. We all know that, right? So this
That's
isn't
right.
something that's going to happen overnight. And so if it is a longer term strategy, then I think to present this work in a time frame, right? So in the 1 to 3 years, 3 to 5, 5 to 7, whatever works for the city is really important, so that when we go to the council, as you're saying, on May the 11th, they at least have an idea of what's coming first and why and what we hope to accomplish. Am I following it? Because I have to give Alvin back all this information. So am I following this dialogue correctly?
So I think that's an excellent point. And I mean, if you take all the reports I've heard over the last 3 meetings together at one time, it's like overwhelming. It's like, oh my God, how am I ever going to get all that done? And it's a little overwhelming. So again, it's okay in my view that, gee, one of the recommendations is that we, hear a broad list of recommendations that we've come up with, but they're not prioritized yet. Maybe in the first 3 months of the commission's work is to prioritize, what is a A, what is a B, and what is a C, and continue that planning to get you to full implementation. But, identify in the first 3 months, what of all these things are really easy for us to do and can knock out of the way, or take 10 years to get done, or they're so systemic, it's just an ongoing process forever and ever, right? So that can be part of the recommendations, is that we still need to refine, the strategies, if you will, and the prioritization. Yeah, it will take time. That's an excellent observation. We'd suffocate probably if we thought, oh, we're going to get all this done by the end of the year. I mean, that's not happening. You know that. We know that.
Mayor, if I may add, the council is just the first hurdle, because it's going to have to go to committees, the appropriate committees, such as your Community Development Committee.
Yeah. With all due respect, I mean, I know Councilmember Gregory, you're, and I've listened to you, I think, quite well over the last few years about driving things to committee. But if we take it to the council as a whole, I think we're going to be good. I mean, that's the mission of this commission, is to report back to mayor and the council. We should do it to the council of the whole.
If that works for you.
Yes, sir.
I just know my members. But one thing, Mayor, that I really wanted to point out and give kudos to Kimberly for taking up the mantle, okay, when it was headless, and coming out with a really, really great report. I mean, you didn't have to do it, but you did it. And I think under your leadership, the subcommittee has been quite remarkable. And
Thank you, Councilman Dudley. You intimidate me sometimes, so that means a whole lot. But honestly, it's a testament of that committee. They are passionate folk. And so I'm excited. I'm taking notes as you guys are talking, because they've been emailing me like, when do we get back to work? So although volunteers, they are certainly committed. And so I am honored to be able just to be their mouth for tonight. So thank you.
Saccharin, are you frozen there?
I think he's frozen.
I think he's frozen.
Frozen. Maybe I mean, is there anything else to bring before?
So can y'all hear me?
We can hear you, but you're crackling.
Turn your video off, maybe.
Gone.
Uh-oh, we lost.
You kicked him out of the meeting.
We'll fill him in. And
That must be a sign.
Right. And there's one aspect of all of this, Mayor, that's sort of just getting started, and that's this whole zoning piece, of which will feed into the comprehensive plan at some point. And I think that Ross has had an initial meeting on that. So as we move forward, at some point we're gonna talk about zoning issues and how they can be changed in order for there to be equity.
Jason, you're back.
I am back. Is everyone still here?
Yes.
We are.
All right, great. Is there anything, do we have anything else to come for the business of this commission meeting this evening?
Jason, can I just make a quick comment real quick?
Sure, go ahead, Ross.
Thank you, and thanks for everybody's reports today. This is very informative, and Councilman Gregory, I appreciate the reference to the issue that we all know is the biggest issue and the one that'll solve all of our problems, zoning and land use issues. And I had a great hour-long meeting yesterday with Darren and Abraham, and we covered a lot of great ground, and I look forward to continuing that discussion because I really think it's important, not just a super important issue, but it happens to be the issue that local government, the city of Charleston, has the most direct control over, right? We run zoning. We don't run healthcare in the United States or in the state of South Carolina or in the city of Charleston. We do run land use, planning, those types of decisions. I mean, that is what we do. Other than, first responders and, public works and recreation, things like that. That's way, way, way in our wheelhouse. So that's very exciting. The other recommendation I'll have is that, when we talk about bringing a report to council, I think the more streamlined and focused this thing is, the less opportunity we have for friction points, for people to poke and take and grandstand on, frankly, and derail perhaps some of the great work we're doing. So perhaps if there's I don't know if I want to call it an executive summary or something that is, sort of a distillation of the high points and the things that we know have the most consensus on. I just am trying to avoid a situation where this report comes to council and it just becomes a very, I want it to go smoothly. Let's just put it that way. So I just throw that out there. I don't have all the answers. I just want us to maybe be thinking about that.
Thank you, Ross. Jerome?
So I'll remind us that one of the hallmarks of the conversation that we have is that is going to be some uncomfortable conversation. So, Councilman, with all due respect, it's going to be hard. It's going to be difficult for us to do our job, okay, and there not to be some difficult conversations, okay, so I'd be concerned about that. The other point, just want to recap. We're shooting for a May 11th presentation. Between now and May 11th, Amber will lead us cross groups to meet and to begin to put together the document that will result in a presentation on the 11th. That's my understanding of the marching orders.
That's my understanding. And I think what would be easiest for everybody is myself, Dudley, and Amber will get together and we'll send out a roadmap, basically a timetable over the next 2 months for everybody to have. And I do think, to Ross's point, I don't, I'm not going to speak for Councilman Appel, but I think he was talking more, less about the content and more about the process. Things do get bogged down. And I think it's incumbent upon us. And I think, Jerome, this speaks to your idea earlier about having a strategy. So we're moving from recommendations to strategy. And I think that's something that Amber, myself, and Dudley can talk about. We'll share that with certainly with the commission members. That will give us some ammo so it's not too complicated, that we've really thought it through. But to your point, Jerome, I hopefully some of the items will be uncomfortable. And if they're not, then we're not doing our work. So with that, is there anything else for the good of the order tonight, or anything else to come before this commission? With that, we are adjourned. Y'all have a good night.
Thank you,
Good
guys.
night.
Take care. Bye-bye.
Thank you all.